Have you ever felt stuck in your brain injury recovery journey, not sure what to do next? Today, we are going to be talking about tools for healing in brain injury recovery because there are so many ways to approach healing from brain injury, and it's not a one size fits all approach. Every injury is different, and that's why it's so important for us to understand that there are root causes and some other things beneath the surface of brain injury. So, today, join us for our theme of tools for healing. There is always hope, and you are not alone. Hi, I'm Cristabelle Braden, and this is my brain injury podcast, Hope Survives. This is an uplifting podcast to bring hope to your darkest days. As a survivor of traumatic brain injury and multiple concussions and re-injuries, I know what it's like to struggle to find hope. I don't want anyone to feel as alone as I did, and that's why over 10 years ago, I started an online community called Hope After Head Injury, which has now launched into a nonprofit organization called Hope Survives. Hope Survives envisions a world in which every survivor of brain injury and every member of their family are seen, loved, heard, valued, supported, uplifted, and never alone. This podcast is an extension of that, and I'd love to invite you to join along as we explore the realities of life with brain injury, with messages of encouragement, interviews with doctors and professionals, and survivor and family stories. No matter where you're at on your journey, there is always hope.
With a little hope, you can make it through today. With a little faith, someday you'll get through the pain. Just a little love is enough to light the way through your darkest night. Hope survives. A little faith, a little love. Hope survives.
Welcome back to Hope Survives podcast. We are so glad you're here, and we are in week 3 of Brain Injury Awareness Month. This week's theme is tools for healing, and I'm so excited that Dr. Jeremy Schmoe from the Functional Neurology Center is here with us today. So we are going to be talking about a range of different innovative approaches and practical strategies to support those who are on a journey to recovery after brain injury. We're going to talk about the world of functional neurology, the importance of a comprehensive care plan, the order in which the therapies that you do is important, and how identifying root causes can lead to more effective treatments. There is hope, and we are so excited to share. As we're talking about Brain Injury Awareness Month, as you know, Hope Survives, or maybe you don't. Maybe this is your first time listening. Welcome wherever you're at on your journey. But Hope Survives just launched as a brand new nonprofit, and I'm so grateful and excited. I just want to thank our Hope Sustainers and those who have pledged to be monthly donors for Hope Survives, as we are running monthly support groups, introducing new programs all the time. We have workshops in the works that haven't been announced yet. We have our workshop at the end of this month on exploring ambiguous loss and grief processing. We're just so grateful to those who have chosen to support us. And if you are interested, the information is at hopesurvives.org/give. We would so honor any way you can support us, whether it's just uplifting us in prayer. You could join our prayer team or just pray for what we're doing. You can connect on how to, tangibly support on our website, or simply just being part of our communities and an encouraging voice. That matters so much. And we want to thank Dr. Schmoe and the Functional Neurology Center for being a corporate sponsor for this podcast and for Hope Survives. We are so grateful to the FNC, and you're going to hear today just how incredible Dr. Schmoe is. He has been on this podcast before. We are so excited to welcome him back to the show. Dr. Schmoe is the founder and director of the Functional Neurology Center. And for more than a decade, he's been working with patients with complex neurological dysfunction. He manages patients from all over the US and internationally, thousands of patients with brain injuries, vertigo, dysautonomia, dizziness, movement disorders, neurodegenerative and developmental disorders. He really enjoys seeing the most complex cases integrating neuro rehab, manual therapy, lab work, and nutrition. He's completed extensive postgraduate training in functional neurology, neuroimmunology, and functional medicine. He's worked with many professional NHL and KHL hockey players and has been highlighted in Minnesota Hockey Magazine. He's been also worked with motocross riders, X Game, snow sports athletes, Olympic figure skaters, equestrian athletes, and high school and collegiate level athletes. From all the major Minnesota pro sports teams, they have come to him for help with brain injury or concussions or vestibular, wherever they're at. He just has a lot of information. You can read more of his bio on the fnc.com. And we just want to thank Dr. Schmoe and the FNC for being a sponsor for Hope Survives. But more than that, he's become a friend. I mean, he's been on this podcast for many years. As some of you know, he has helped me in my brain injury journey as well. And, was able to help me to navigate a lot of the vision and vestibular and dysautonomia things that were underlying in my brain injury journey, but for so long went untreated. So I'm really excited about today's podcast. What I love about what he's going to talk about is that he's going to talk about some tools for healing and things you can do at home and things that you can start to look at for yourself that I hope will be helpful to all of you wherever you're at. So if you're a survivor or a family member, we are so glad you're here. We're so glad you're listening. And thanks for being part of the Hope Survives family. Get connected at everything at hopesurvives.org. And let's get started. I am so thrilled to be back here once again with Dr. Jeremy Schmoe from the Functional Neurology Center. Thank you so much for coming back, Dr. Schmoe.
Yeah, thanks for having me, Cristabelle. Excited to be here.
We are so grateful for your support of Hope After Head Injury and Hope Survive through the years, and we can't wait to learn from you more today. So thanks for coming back on the podcast.
Yeah, let's do it.
So today we're talking about tools for healing and what that looks like in brain injury recovery. And so you are kind of uniquely positioned in that you have a lot of experience working with brain injury for many years, as well as understanding new research and what the future of neuro rehab looks like. And so today I kind of just wanted to open it up to talk about what do you think are the essential tools for healing that every survivor and family should know about? And where do you think brain injury rehabilitation is going in the future? So let's start wherever you want.
Yeah, that sounds good. So my background is I'm a chiropractor and I have training in what's called functional neurology. I've been doing it for 15 years. That's how long I've been in practice. But then I've been studying all this information since 2008. I work with a lot of patients with visual and vestibular issues. So a lot of patients with visually induced dizziness that have trouble with background movement and motion, and they feel off and rocky and floaty and dizzy and off balance. That's kind of like my passion, is helping patients that have head injury, concussions, trauma, and I call them chemically induced concussions. So things like, Lyme and mold and mycotoxin illness and issues with the gut. You might have concussion-like symptoms, but you never actually really hit your head. So I had a couple concussions skiing when I was younger. So basically it went concussion. I went down to Costa Rica, got Lyme and Babesia infections, and had a bunch of really weird visual, vestibular, vertigo type symptoms, anxiety, weight loss. So it's this kind of integration of neurological problems with inflammatory based issues that were affecting my nervous system and affecting the brain. So that's like really what has pushed me into wanting to help people with chronic symptoms, is my background with that. And then at one point, I think me and my wife tallied, I had like 50 different symptoms of weird, bizarre things ranging from tremors to anxiety to feeling floaty and rocky to not being able to look at anything to having a hard time even driving and like dealing with the motion and movement going by. And I mean, I got better from that. And, how I got better was, integrating functional neurology rehab with a lot of high level functional medicine and looking into gut health and infections and, tick-borne co-infections and even looking into like mycotoxin in mold and detoxification. It's integrating all that together. And I think a lot of people have, some issues with their neurological circuitry, obviously, some issues with inflammation, and obviously structural issues. And all of that compiles on one another. And our approach is to look at everything, because it might be working on your VOR or doing vision therapy could get you 20% better. And that 20% better might open up a huge amount of brain energy for you. But what I see happens with people a lot is you're working on that, and then your system crashes and fatigues because people neglected to look into any of the underlying issues that might be going on. So, in our office, we do a lot of intensive care where we initially just try and get the neurology better, get your nervous system functioning better, give you a better idea of where you are in space and feeling more grounded and how your brain detects gravitational load. But then we also screen and run advanced labs to look into all of those other aspects as well. And really, that's where I think you hit home runs with people, and where a lot of patients are afraid about doing intensive care because they're like, how can I get fixed in 5 days? Well, that's the initial beginning steps of figuring out what your problem is. I mean, it literally might take 5 days just to like see these different things with you and go, oh, wow, there is a major neurological fatigue aspect with you. Even when your vestibular system is doing good, let's have you fill out this questionnaire. Oh, wow, you just hit all the check marks for having mycotoxin illness. All right, let's do a mycotoxin urinalysis. Let's look at your gut health. And then when you leave, we're going to work on that. So it's really trying to integrate neurology, metabolic, and structural care combined in a very specific way for each person. I think that's the future right there. It's like hitting all of those pieces of recovery, and you're just tapping away. And then it's like, okay, well, now you're 80% better compared to being like 40% better with just having all of these ups and downs and ebbs and flows of stress in your immune system and how cognitive load takes a toll on your brain.
Wow, that's really great. Thank you for sharing. I love how you described how we're really looking for underlying causes, root causes, a whole picture of what's going on, because you're absolutely right. So many practitioners just look at one thing at a time. And I can't tell you how many people are in my Zoom support groups talking about, well, I did vestibular therapy, but I'm just dizzy all the time. It didn't really help. Oh, like I was trying to get my eyes checked out, and I went to a neuro-ophthalmologist. They thought I needed a prism, but then everyone's getting all of these different pieces in different spots without really understanding how they connect. And that was really my story before I found you and came to the FNC. It's got to be 5-6 years ago.
Like 6 years, yeah.
6 years ago. And it changed my life to know that this could all be integrated together. And also, I want to note, thank you for sharing your personal story with a lot of what you've been through as well, because I think that's what makes you such a great practitioner, is that you really know what it's like to be there because you have been there yourself.
Oh, for sure. I mean, there was times where like everything was different almost every single day, where like I would wake up and like, all right, things are going to be weird today. And, I might feel off balance or feel a little funky. And it's like, what can I do to help kind of get my nervous system to go back together? And it was bizarre because it would be different things all throughout the day. So sometimes I would have to do like a figure 8 movement, and I would do that. I'm like, oh, wow, I feel like a little bit steadier. Other times I would have to like move my hand in a certain way or move my eyes in a certain way. And when you throw on neurological inflammation, and I have a whole article that we've written on this that kind of goes into all the mechanisms, but when you throw on neurological inflammation onto circuitry pathways that are unstable, the symptoms just go like this. And that's what a lot of people explain to me. Like, it's just different all the time. There's not one thing and it just stays steady. And then when you go in and you see multiple providers and you're like, yeah, today, like my leg feels like it's floating and it's over to the right. I mean, they're going to go, I mean, this sounds like it's in your head, you know? So yeah, obviously it's in your head, but it's the mapping of your brain. And there's very precise areas that give you these kind of symptoms with concussion. So with head injuries, midline regions of your brain get affected, and a lot of it's in the more central cerebellar circuitry for detecting gravitational load. And there's these pathways, they're called the nodulus and uvula, and they are involved with something called velocity storage. So your nervous system and your vestibular system can actually get wound up. And everybody's always looking for dysfunction. Like if you move your head one way, do your eyes not come back? Well, what ends up happening with concussion is you get hyperconnectivity between some of these areas of the brain. So some pathways are actually doing too much. So you go in and you do the examination and people don't find anything because everything looks good. But when pathways are doing too good because they're not being gated appropriately, that can also be a problem. So some of the things that I ask patients is, all right, like close your eyes. Let me know how you just feel sitting there. All right. If you close your eyes and you go, all right, I feel like my body is going like this. There's something going on in that central circuitry that helps you detect gravitational load. And then if you tilt your head to one side and you feel normal, and if you tilt your head to the other side and you feel floaty and dizzy, there's some sort of central mismatch that is occurring in your brainstem of integrating the neck feedback with the gravitational load sensors in your inner ear and how it's firing into your brainstem. If that's abnormal and that's doing that all day long, including when you're sleeping, that is going to lead to a lot of changes in your whole autonomic nervous system, which can cause anxiety, gut dysfunction, changes in your immune system, changes in how you get good blood flow up to your head. So what I see a lot is people do therapies that are like 2-3 steps down the road. They're all the right therapies, but they're not in the correct order. So doing things that help you detect gravitational load are super imperative. And we have many people where we just work on that. And the things that we do seem so simple and they're actually so low tech. We have all this high tech stuff at our clinic, which I'll talk about, but we do these things that are so low tech that we need to get you stable first. And then we can move on to doing, neurovisual training or working on your neck or doing more advanced vestibular techniques. But if you don't have the sense of just embodiment and detecting gravity appropriately first, I think that's step number one. And I think that's missed with a lot of people.
So when we're talking about tools for healing, right? Maybe one of the tools could be the therapies should be in the right order. I don't know how to define that, but I love how you said it could be the right therapy in the wrong order. That's so critical and important because, this person could need vestibular therapy to go off that example, but maybe they needed something else checked first.
Sure. So, just imagine if you're doing vestibular therapy, but then you have craniocervical instability and you have stretching and fraying of your transverse ligament that stabilizes your C1 on your C2. And like every time you're moving, all of your large extrinsic muscles in your neck and your trap are gripping in to stabilize you, and they're giving bad feedback if you're shaking your head to like activate your vestibular system. That's just like one example. Or, say if you're trying to do vestibular rehabilitation, and there's some amazing vestibular rehab therapists out there. I'm just going to throw that out there. And everybody that's high level is starting to like kind of catch into this. Well, we need like stabilized gravitational detection before we move on to other things. And it's all about the order of the rehab. Like say if you're trying to do chiropractic care or physical therapy, but the person has anterior canal BPPV that's been there for 4 years. Like, of course, their neck is going to posture because their brain, every time they take a step and their foot hits, thinks that they're moving in a certain direction. And consciously, like people might not feel all this stuff because the brain adapts, but what you feel is, oh man, like my pelvis is super tight and my low back is tight and I'm turned and I'm postured in this way. And you might not physically look like that, but your brain is still reflexively firing all those muscles, and it thinks that you're actually postured in those positions. And then your
Wow.
neck gets really tight. And then people go in and they adjust it and rub it away and acupuncture it away, and nothing against any of the techniques. I'm just saying that it might not be the right technique in the right order for what's going on with their neurological examination based off of what we're seeing. So I really think it comes down to all providers need to be trained in functional neurology and have a more in-depth bedside examination. And everybody is so into, well, what's your MRI show and what does your caloric testing say? And like, all those things are great, but I think the art of the bedside examination has been lost. And that's what I preach about, is like doing good, thorough bedside examinations, looking into these reflexes really in depth and the idea of where your body is in space. And don't just jump past that and move into, all right, well, let's just check your pursuits and your saccades and your gaze holding and just check your VORs. Well, what if their VOR is good when you move quick, but if you just like barely move their head slow, they feel like they're spinning. All right.
What's a VOR for those who
like,
are not
yeah,
familiar?
like vestibular ocular reflex.
Okay, so it's moving
So,
your head to do
yeah,
testing.
like if I'm looking at your nose and I move my head one way, my eyes have to come back equal and opposite.
Got it.
And that's just a classic thing. Like everybody's checking VOR gain to see if it's good. But when you injure these very midline cerebellar areas, things can actually be off when you're just like moving slow.
Mhm.
All right.
Off is such a good word for it.
Yeah.
And it's not a very specific word, but it's something that I think a lot of survivors can relate to, is just, I just feel off. I feel wrong. Something feels not right. And I remember I spent over 10 years just feeling off all the time, thinking that that was what a brain injury did. Like, I knew I survived a brain injury and I just thought I had to feel off all the time. And you really helped me to understand on a deeper level that, no, not everyone feels like they're rocking when they close their eyes, or not everyone, feels like they're on a boat, or, not everyone's heart rate jumps to 1,000,000 when you walk up the stairs. And a lot of these were dysautonomia symptoms that I had no idea about.
Yeah.
And it changed my life knowing that there was another cause besides brain injury, because so many times people use brain injury as the root cause. Brain injury is not a root cause, but your brain injury, at least from what I understand, your brain injury can cause dysfunction in a lot of different systems in your body. And so taking a functional approach, looking at the way the systems integrate together, that is what is going to help us to heal.
Yeah, for sure. It's like, all right, you had a concussion, you had a brain injury. Say, for example, if your imaging is normal, some people obviously don't have normal imaging, but there's a lot of people that are walking around. They're like, yeah, they told me the MRI is normal. Like my CT scan's good. So you don't have a brain bleed. There's no, major stuff that's really going to take you down. But it still doesn't mean that the pathways aren't like integrating and functioning well together. Right. You could have some areas that are like really talking a lot to each other, like too much. Like there's a huge interplay between your vestibular system and your limbic system. So when people have this sense of they just don't know where they are in space, it causes a lot of anxiety. And then if you have a lot of anxiety, well, that's going to change your whole autonomic system, which is going to change your gut, and it's going to change your respiration. It's going to change your breathing. So like anxiety could be a component, but it's like, what is the root cause of that anxiety? If there isn't a major vestibular cause or other cause, I mean, it could just be neurochemistry, and changes in inflammatory levels and the whole kind of concussion chemical soup of what's going on in the brain. So, one of the things I see is like people come in and if they truly have like a normal neurological exam and we're not seeing anything, but they have all these symptoms, my question, I just go, well, what the heck is going on? Like, is there something else like neurochemical or inflammatory or something that's being missed? Did you have something already going on prior to getting a concussion? That's the thing. People can have problems even before they have a concussion, and then it comes out and things get worse. Like what if you had a gut parasitic infection, or if you had leaky gut, or if you had GI inflammation, all these food allergies and sensitivities, and you've been eating really unhealthy for 15 years, and then you get a concussion. Like, don't you think that maybe that could be a player? So those are all the things that I think people need to consider. And I don't think there's just going to be like a magical therapy where it's just the gyrostem is going to fix you. Or we do have some people where the gyrostem, we do move them in a very specific way, and it's like, wow, their eyes are stable. I actually just got done talking with a patient. She had a concussion 7 years ago, and she just fainted walking into her house. When a handyman was coming in, she fainted and just hit her head, fractured her skull, and she could not keep her eyes stable at all for 7 years. And we did all sorts of therapies, and I wasn't making the changes that I wanted. I'm like, all right, we're going to rotate you backwards in the chair. And she's like, all right, let's go for it, because we're kind of hit our limit of trying other things. We do one rotation backwards. She stops, I go up, and her eyes were stable. And it's 3 weeks later, and I literally just spoke to her, and she goes, this is the most improvements I made in 7 years. And I had only seen her for 5 days. 3 of those days, making some pretty cool changes, but them slipping and like going away, and then doing one specific therapy and making a big change. So if you can get precise, you can make some pretty dramatic changes with people. I just don't think there's just one magical adjustment, one magical eye exercise for a lot of cases. I think it's working on multiple different things, working on proprioception, working on neck, working on vestibular, working on visual, working with body-based exercise, working on mental health, working on that. It's all of that combines together to get you to 100%.
Yeah.
If that makes sense.
Yeah, no, I appreciate it, and I love that. So if someone's listening, and let's say they're a survivor or their family member and their loved one has gotten injured, and they're going, okay, that's all well and good. That's a lot of information. I'm feeling pretty overwhelmed by all of this. If we could break down, like, what are some tools for healing that you think every single person needs to know about that they could implement at home? What are some specific tools for healing that might be a little less overwhelming than trying to, go through the maze of therapists and doctors to figure out the order of what works?
I mean, honestly, just starting with a good comprehensive blood chemistry panel is a good place to start. Like if you're just looking for easy stuff, is look for your vitamin D levels, your magnesium levels, your B vitamin levels, look for iron deficient anemia, look at your ferritin. So generally just looking at and making sure that you're not super inflamed. So if you've been doing a lot of rehab and you're not getting better, and your ferritin's at 10 and your iron storage is low, well, that's oxygen and perfusion is one of the things that you need to recover. So just breaking it down into oxygenation, nutrition, and activation. All right. If you've done every therapy, like every activation strategy, and it's not getting better, like what's being missed? Either everybody's missing the right therapies, or there could be some underlying thing that's going on that's being missed. And it could be diet. It could be something inflammatory. It could be your brain's not in a place to be able to heal because there's so much inflammation. So that's something easy to consider that honestly, like most providers don't really talk to people about, is their underlying energy and inflammatory status of where they're at. Looking into the cervical spine is obviously very important. And if you've done a lot of vision therapy and you've done a lot of vestibular rehabilitation, but yet you still have headaches and you're still off balance, there could be issues going on with the cervical spine that need to be addressed. We do a lot of like low-level laser, or Coney is the company that we use, low-level light therapy. Their green-violet laser has been really helpful for headaches, and we actually shoot it in the mouth through the ligaments, like through the throat, and we'll go here to work on trying to decrease inflammation and get better blood flow. And we use a technology called ARP wave. It's a type of electrical stim. I think you love that one. And it really helps with headaches. So
yeah, it feels great.
It feels great. And we'll treat like SC joints. We'll do suboccipital. We go through the neck, and we're doing like vestibular activation while we're working on the neck at the same time. So that's brings me kind of to the next point. Sometimes doing individual therapies are great, but if you stack them with other things, it's the integration of them all like working together. So if you're doing vision therapy, but you're not doing like body-based movements or working on like primitive reflexes, and you're purely just working on, say, convergence or getting your eyes to be able to diverge appropriately, we could be missing that. You have some neck instability, and the brain likes stimulation for the most part. So like layering therapies together can make a lot of changes with people. So yeah, decreasing inflammation is number one. Improving blood flow to the head, specific supplementation out there that can help get better blood flow. So we like to, use vinpocetine and huperzine A. I don't want to go into all the details of the supplements, but there's supplements that we use like ginkgo, feverfew. There's things that can help get better blood flow to the head. We like to use curcumin and resveratrol and glutathione to decrease inflammation. Always doing gut repair protocols with people when they leave to help kind of improve their gut health. So we're trying to do a lot of neurological work and kind of combine that funk med side to it. And that brings it together for a lot of people, especially if it's chronic. Like if you're 3 years, 5 years, 10 years, and you're not getting better, like there has to be another component that has developed since your injury. Okay. Right. There's concussion. There's probably changes in gut barrier integrity, and then changes in inflammatory status. And if it's 5 years and you can't exercise, well, I'm not going to say, all right, just hit that exercise hard. You need to work out harder. There's probably something going on that's preventing you from working out. And we got to figure out what that is. Yeah. And there's things that you can do to improve blood flow to the head and help with recovery. But it's just a good, simple way to think about it is you need the right activation, you can't be inflamed, and you need good oxygen, so you can't be anemic. That's just like head injury basics 101 for recovery.
This is great, Dr. Schmoe. Thank you so much. It's just so crazy. Every time I talk to you, I feel like another piece of the puzzle just clicks in my head. Yeah. When you were just talking about this, I had anemia like 5 years after my TBI. 5 or 6 years, and like my PCP had me on iron supplements or whatever, but it was because I was a vegetarian at the time, and I just wasn't getting enough iron, and I never really thought about how much that would have affected my symptoms, because I kept getting re-injuries around that time because I kept falling, because I was just not stable, and there were a lot of other issues going on as well. But yeah, it's just really helpful to know that there are some things. So I love this encouragement to get a blood panel, look at the metabolic system, and just know that there are a lot of different avenues that you can approach healing from brain injury. There's no one size fits all. There's no one magic therapy. And, it's it can feel fatiguing to say this, but like to keep trying different things. Yeah. I know that can also feel overwhelming if it's been a long time, but really knowing that there is hope for healing, and that there probably is a reason. If you have a symptom, there's a reason for it. So let's find the reason, is what you're trying to say.
Yeah. And trust me, like I understand, like I'm in Minnesota. I also understand that not everybody can travel here to come work with us. Right. Let's just be realistic. So if you're just thinking about it, common sense, like you need to know if you're super inflamed, if you're anemic, to help you recover. That's just like basic stuff. And a lot of people just gloss over that basic stuff, and they're hammering their VOR, and they're, doing all their gaze stabilization, and they're doing all this stuff, and they're exercising, and they're getting pooped out from physical exercise and doing the Buffalo treadmill protocol, like all these things. And people haven't gone through, like I have this whole checklist in my head. I go through and I just go, I'm like, all right, boom. Like that's the thing that's missed right there.
Yeah.
All right.
And you say it's basic, but nobody tells us this. Like we're not told this. So it's like, it's so basic that it gets skipped. It's so basic that people don't think about it.
So basic, and it's so simple that it gets skipped.
Yeah, that's so good.
And then you move into the therapeutics, and everybody is doing amazing things. Like I have some friends who are amazing neurooptometrists. Like I presented at the International Sports Vision Association this year with my friend, Dr. Paul Brewer, and we did this concussion presentation. And, there's like 200 amazing neurooptometrists from all over the world. And like they're on it with the eyes. But I did talk with a lot of people there, and they go, we don't really understand clinically. Well, we understand it, but clinically from a therapeutic standpoint, it's like, what do we do with vestibular? Right. I'm sure there's a lot of vestibular therapists that are go, all right, I totally understand the vestibular, but I don't 100% understand how the vestibular system and the cerebellum like integrates with understanding the gain and changes in depth perception of how that affects eyes. All right. And I'm not saying I understand everything out there. I'm saying I understand a lot about multiple different things, enough to go through and develop a system to strategically say that I think the problem's this, that, or that. And if there's something that I can't help with, then I've aligned myself with people that I know that can help with a certain thing.
Yeah.
All right.
That's
So
great.
I can't prescribe, appropriate prisms for people. That's not in my scope of what I do. But I'm good at looking at neurovisual integration and vestibular and cervical spine and all the metabolic piece, and I can tackle a lot of that. All right. If I think that you have some sort of chronic pain-based condition that would do better with, ketamine or something like that, I have people in my network that I could have you refer to for a consultation. So I think it's, as a provider, you need to understand all the people that you need, like in your circle. They don't have to all be on your team. You just have to develop a network of good people. And that's what we've done here in Minnesota, where it's like, okay, we need to do this, that. We need to collaborate with other people to get people better, basically. So yeah, I think the missing pieces are those basic metabolic pieces for recovery. And then it's the therapies not doing the things in the correct order based off of where people are at. And then, I'm just going to be honest, but some people have their brain has been changed. There's been a traumatic injury. There's changes in brain circuitry. There might be some pathways that are just broken and not able to get better. I'm just going to let people know that there might be some pathways that pathway is not getting better. And what I'm good at is trying to figure out, well, if that's broken, what other systems can we use to tap in to make everything else better? Because everybody might be working on that broken thing and it's just broken, like it's not going to get better. And you're trying to just hit a thing that's a problem over and over and over and over again. And that makes people feel crappy. Like, what if all right, we're really going to make your neck proprioception amazing, and we're going to throw in all this cool rehab to make that as good as it possibly can be. That might be enough to hold your sensory system together, where the gain of your VOR that was decreased and not working, well, that doesn't matter so much anymore because we made your neck so much better and we got your vision so much better. And then you're fine.
I love that. Instead of
Right.
just focusing so much on maybe a pathway that is not improving, to improve everything else so much more
Yeah.
that it makes up for it. I love that.
You gotta-
That's so helpful.
You got to make up for it. So
Yeah.
Yeah.
Dr. Schmoe, I'd love to keep chatting. We are running to the end of our time here. But we will definitely have you back for sure. And we're excited to team up with you throughout this year and team up with the FNC. And I can't wait to see more that we're going to do. But before we close, we always ask, what are your final words of hope for our listeners?
Yeah, I mean, honestly, I've seen so many miraculous things just in like the last 3 months with people. I mean, I just saw a kid who was one that had a concussion. We got hit in the head with a football, and I just saw him. He's 5 years old now. All these balance changes, and I was actually able to make changes like that. All right, in literally like 15 minutes. And have the kid looking from being all over the place to being super steady and balanced in a very short period of time. It's like the nervous system is plastic and it can change. We've seen people that are 7 years post-injury that can't stabilize their eyes make improvements. So the brain can adapt and it can change. We had this lady that she's had long haul COVID symptoms for like the last 3 years. She came in to see us in a wheelchair. We just saw her yesterday. And she walked in. She had a walker. And she came in, she walked, her whole coloration, everything looked better. And that was only like 1 month after rehab. And that was from working on everything together. It wasn't just, all right, we're going to make you do sit to stands and we're going to drill sergeant you and like you're going to be standing in a month, It was working on some of that inflammatory stuff and hitting the eye issues hard. And nobody had looked at her brain. Everybody's thinking about like peripheral inflammation. Nobody looked at the brain circuitry. So it goes in different directions. You got to just figure out where to jump in with people. But the brain is miraculous. You can totally change it. You can improve function. You just got to know kind of where to jump in, and you can get people better.
Yeah, that's awesome. Thank you so much, Dr. Schmoe. So encouraging, so much hope. And we are just so grateful. Thanks for sharing with us.
Thanks for having me.
We'll be in touch. Thanks for tuning in to Hope Survives podcast. Make sure to subscribe and stay tuned, and would love for you to consider leaving us a rating or a review. Check out hopesurvives.org for more. We'll see you next time, and remember, there is always hope.